This is Talk with Audrey. Welcome back. Patients with autoimmune diseases are at a higher risk for severe complications of COVID-19, which means that social distancing guidelines may be in place for autoimmune patients longer than the general public. Joining me today with information about a new online platform to offer personalized resources for patients with myasthenia gravis in this time of social distancing, Dr. Ericka Greene, Program Director, Neurology Residency and Neuromuscular Medicine at Houston's Methodist Hospital in Houston, and Rachel Higgins, a myasthenia gravis patient and Myasthenia Gravis Foundation of America community leader from Austin, Texas. Welcome.
Thank you.
I appreciate both of you joining me. So, Dr. Greene, what is myasthenia gravis and how does it affect patients and their support communities?
So myasthenia gravis is an autoimmune disease, and autoimmune diseases are those diseases where your own immune system attacks a protein or cell in your body. And in the case of myasthenia gravis, it's a protein on our muscles, our skeletal muscles. And this protein is important for muscle contraction. So the signs and symptoms of a patient who has developed myasthenia gravis is fatigable weakness. The more they use it, the more weak it becomes. And so often they'll present with double vision or lid drooping that impacts their ability to see, focus, read, watch TV, even drive. Their swallowing and speech muscles, so they might develop nasal speech the more they talk, difficulty chewing tough meat, swallowing water. And then it can progress to the rest of the body, holding one's head up, blow drying your hair, climbing a staircase. And in some cases, it can involve the breathing muscles. And that's when we get very concerned in terms of requiring hospitalization. So as you can imagine, it just doesn't affect the patient as an island, as they say, but it affects their family, their ability to manage their home, to have social outings, to work. And so this is not just a patient disease, this is a community disease. And that's why the platform such as mgunited.com has really bridged the gap between the patients, communities, and healthcare providers.
It sounds a lot like Lou Gehrig's disease. Do people sometimes confuse the two conditions?
If we had time, I'd go into a whole lecture on that. So yes, and I also take care of patients with Lou Gehrig's disease. And so when these two diseases were first described, often they were mistaken for each other. And over the past 100 years, we have learned so much that although they may present similarly, there are distinct differences. And right now, in terms of MG, we have treatments that actually change the survival and the quality of life. We have that for Lou Gehrig's disease, but on a different scale.
Who's at risk?
So myasthenia gravis is a sporadic disease. What that means is for the kind that we're talking about, which is the majority of cases, there is no genetic direct cause. We think that it's many factors. Although there's not a gene mutation that's passed down from family to family, there's probably an inherent genetic risk. Just like diabetes runs in the family, maybe high blood pressure runs in the family, and also age and environment. So anyone can acquire myasthenia gravis.
And during this time of the COVID-19 pandemic, someone with myasthenia gravis has then a compromised immune system, which is why they need to practice social distancing for even longer and why they're at greater risk.
Exactly. They're on treatments often that suppress their immune system and puts them at greater risk for infection and even more severe infection. So our patients truly have to commit to these guidelines and for a lot longer than the average person. And Rachel Higgins can speak to this in a much greater way than I can as a patient.
I think exactly what you said, Dr. Greene.
And Rachel, how has myasthenia gravis impacted your life?
In a multitude of ways, and in its simplest form, it was the most scary when the symptoms began. Many of the symptoms you heard Dr. Greene describe, we experienced, and I say we because it's definitely a family disease. To experience that first 12 years ago, and then to experience the roller coaster ride that is myasthenia gravis, to understand the importance of finding medical community who understands myasthenia gravis, the importance of staying connected with others who live with myasthenia gravis. It made our journey much easier once we came to that place where we're able to be connected. And coming to this current day and time where we're living in a COVID situation, so many become isolated, they forget that we can remain connected in this season of COVID. We can remain connected through virtual platforms such as mgunited.com, mg-united.com. It's a great place where myasthenia gravis patients are sharing their story. How does MG affect their lives? And it's great because those new patient families of myasthenia gravis is a great soft landing place for them to start their research, to start their understanding of what is MG.
Well, Rachel, you're a community leader with the Myasthenia Gravis Foundation of America. Can you tell us a little about that organization and how people can participate and where they can go for additional information?
Absolutely. There's a multitude of resources available to us. The MGFA is an excellent source of information as well. When a patient's ready to dive into support groups or research more about drugs that they need to avoid, this is a great place to start with the MGFA. If you're brand new to myasthenia gravis, more often than not, a new family wants to know, one, that they're not alone, and two, am I going to be okay? And I think that's where MG United is excellent because they're demonstrating the patient voice very visually. And so someone can see that, oh, others live with this disease and they're doing okay. Okay, there's hope for me. There's hope for my loved one. There's hope for my mom, my sister, my brother, my cousin. They're going to be okay. And I want to run with them. I want to help them. It's a great tool.
And that is indeed the wonder, quite honestly, of the internet, is that you can go to sites and find support and information. So the site, guys, that just launched is mgunited.com. Go there for some personalized resources and more information about myasthenia gravis in this time of social distancing. Dr. Greene and Rachel Higgins, thank you both for joining me, and Rachel for sharing your experience with myasthenia gravis.
Thank you for your time.
There's more to come on Talk with Audrey. I'll be right back.